So this is going to be a waxing video for eyebrow and lip. First we have to discuss what we're going to do before the client even arrives. And we are going to start with prepping our workspace. We need to disinfect the workstation, bed and equipment using a disinfectant wipe and following manufacturer's instructions. We're going to check our equipment to ensure all devices are in safe working order and plugged into a working receptacle. We'll gather clean supplies needed for the facial service, the waxing service, storing in a clean, closed container, and we'll dispense products needed for the service. We will prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup or tray, or you can remove the product with a disinfected or clean single-use spatula that you can toss. And then close the lid to the product and set the portion cup or tray on the tray. You will place disposable table paper on the disinfected bed to ensure the wax does not fall onto the bed. That's what you're going to do before you greet your client. So you've prepped all of that stuff, and now we're going to get our client. Always keeping in mind that you are going to meet your client already with clean and disinfected hands. We are going to do that again in a minute, but when we approach her or him, we are clean. So we do that, and we're going to escort them to our work area and assess the client's current style. We're going to determine the client's preferences, assess the client's needs, assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area that's to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, i.e. lice, to prevent from safely performing the service. We will assess the client's consultation form for any medications and products used within the last 72 hours. We're going to consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, we're going to assess if the client is prone to cold sores or fever blisters. We'll assess if the client has been using exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. We will, if the client is free from the above, we can carry on with the procedure. So we're going to get our client set up first, and then we're going to wash our hands. So what we're going to do is escort the client to the area. Then they'll put on a drape or disrobe appropriately. We've got them on the bed. We're going to put, excuse me, a headband on the client so that no wax, or we'll get the hair out of the way and there'll be no wax or anything with the client. And then underneath the client, we are going to place a rolled towel to support the neck. And then I'm going to drape the client so that no wax would get on them anywhere before we start our service. And then once we've done that, we are going to wash our hands. So we would turn on running water, wet our hands, and then find a coin-size amount of liquid hand soap. We're going to rub our palms together, and we're going to rub the back of our palms. All of this down to the wrist. We're going to wash between our fingers, and then of course between our fingers and our thumbs. We are going to wash the backs of our fingers and our fingers completely, of course, fingertips and nails. We're going to do that interlocking cleanse under the water for at least 20 to 30 seconds. We're going to wash our thumbs. We are going to wash our wrists. And then we're thoroughly going to rinse our hands under the water. Sorry, my brain is in 15 places right now. Under the water. And once you have that proper rinse, you're going to get some disposable paper towels. And then you're going to turn the water off using the hand that has the disposable towels. Then you can use the towels to completely dry your hands. And then once the hands are completely dry, you're going to discard your paper towels in the trash, and then you're going to find hand sanitizer, that 70% ethyl alcohol. Then you're going to get that pumped out, and you're going to do all of those things that you just did with at the sink with the hand sanitizer. And you want to make sure here for sure that your hands are really dry, because you have to put on disposable gloves. And if they're wet, that makes it incredibly difficult. We're going to put on our disposable gloves. And the first thing that we're going to do, starting with the brow, is we've already talked about their style. What we're going to do is assess the direction of hair growth. So I'm going to look at the brow and figure out how much needs to be taken off, and then, of course, which way the hair is growing, and what needs to be done to remove it. And then I'm going to cleanse the area with an antiseptic. Make sure that it's really, really clean. And once you feel like you've gotten it really, really clean, then you need to make sure that it's really, really dry. So I'm going to go back with just a dry cotton round. You can do that, or some powder. And then before you even think about waxing, you actually are going to test the wax on yourself. So what you're going to do is you're going to take a little bit of the wax on the inside of your arm, and you're going to let it go there. And it feels great to me, so let's just remove that. And then we can go proceed to the client. And I want to apply a nice thin layer. In the direction of the hair growth. And you're going to pull the skin nice and tight. Again, nice and tight. Skin nice and tight. A little headband came off. I'm going to try to fix that real quick. Maybe if I try to put it the other way. That might help stay on a little bit better. Okay. And so I'm just going to remove any residue of the wax right here. And then I'm going to get my tweezers and get anything remaining. Yeah, brow looks good. Let's work on the other side. Pull the skin tight. straighten the skin. And now I need to remove residue. Tweezers. Remove any residue. Tweezing with the direction of the hair growth. That one looks great. And then following the brow now, to complete it, you want to put your soothing gel on. Awesome. So we have finished the brow area and we're going to move on to the lip area. So we're going to assess the hair growth again. Where you want it, where to take it off, which way everything's going. And we're going to clean it with that antiseptic, that pre-step. And then you're going to dry it off because you want the area completely dry to do waxing. If you need to get a little powder, you can. Okay, dry. And then we are going to remove the hair. Applying the wax within the direction of the hair growth. Pull the skin nice and tight. Excuse me. Then we're going to go in the center direction of that hair growth, which is down. Nice and tight. And then we are going to remove any residue from the wax on the lip before we do any tweezing that might have to be done. And we're tweezing with the direction of the hair growth. Not the most fun place to tweeze, I have no doubt. and then we need to soothe. And we're going to bring in our mirror because it's time to show the client. Oh my goodness, look how good those brows look. Look how we removed all that hair. Look at all that. It looks amazing. You look perfect. The skin's a little pink, but it'll be fine. And then at this point, you can discard your disposable gloves. We're going to take these off. And you will do your checkout of your client, and you are going to do discuss maintenance and aftercare, and then potentially book her some more appointments. Then you're going to get her out here. So we're going to talk about how we break down and clean up after she has been checked out, which she has. So we're going to take our single-use items like those disposable gloves, toss them, the little wands and everything we've been using for the wax, the little rounds that we've been using for the other things. All that stuff is trashed. We're going to place implements in a closed container that's labeled to be disinfected. We're going to take all of these towels, bedding, etc., cape, and it'll be put in a closed container to be laundered. And then we have to address our work area. So we're going to identify proper cleaning agent, and we're going to read those manufacturer's directions and follow the manufacturer's directions for mixing and usage. We're going to wipe down our workstation and area with cleaning solution to remove debris, and we're going to identify disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in a salon setting. We're going to follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. We will disinfect electrical equipment, store it in a clean area separate from other implements. And then because of what we did with the disinfectant, you would have had gloves on and then you're going to toss them. So you've done that, and at this point, to finish up everything, you have to wash your hands again. So you're going to find your sink, you're going to wet your hands under the water, and then you're going to get your liquid hand soap, rubbing your palms together down to the wrists, and then you're going to wash the back of your hands down to the wrists. You're going to be washing in between your fingers and fingertip fingers, and then the thumb and the fingers. You will wash your fingers. You're going to wash the backs of your fingers carefully, and fingertips and nails on both hands. You're going to be doing that interlock or lacing cleaning underneath the water for a minimum of 20 to 30 seconds. You will wash your wrists thoroughly. Once you've completed that part of the lather and the wash, you're going to rinse your hands underneath the water to remove the soap, and you're going to do a really good thorough rinse. Once you have done your proper rinse, you're going to identify either a clean towel or a disposable paper towel, and you're going to grab that disposable, and then you're going to turn the sink water off with the hand that has the disposable towels in it. Then you're going to thoroughly dry your hands, arms completely with your paper towels, and then you can discard your paper towels in the trash can. Then you're going to find and locate your hand sanitizer, and then you're going to do all that amazing stuff that you just did with your liquid hand soap and water with your hand sanitizer, so that you can completely dry everything off. And that would be the point when you can move to your next client or service, or you're done for the day. So that concludes your video on eyebrow waxing and lip waxing together.